everyone, and welcome, and thank you for coming out tonight to attend the neighborhood panel. I'm Jenny Levine, the Adult and Humanities Programming Coordinator for Durham County Library. This program was sponsored by the Durham Library Foundation. I would also like to give thanks to the wonderful folks at Hayti Heritage Center who are amazing to work with. I should also mention that tonight's program is being recorded by the People's Channel. It will appear there, and a YouTube video link will be available in a few weeks for folks who could not make it tonight. So see me afterwards if you want me to email you that link, if you're not in the Humanities Society and already on my list. If you enjoyed this program, if you wouldn't mind taking a moment to fill out an evaluation form before you leave, I would appreciate that. This evening, we're going to hear from Jade Buteau, Assistant Site Manager of Stagville Plantation, about the historic site's influence on Durham's population. But first, I'm going to briefly introduce the folks who will be up here tonight. Ms. Leonita Inge, Race and Southern Culture reporter for WUNC, has graciously agreed to moderate the discussion by our esteemed panelists. Mr. Benjamin Filippo, Executive Director of Preservation Durham. Maybe you should come up as I call you out. We didn't practice this. Ms. Aidil Ortiz Hill, Healthcare Division Program Officer for Central North Carolina and East Durham resident. Dr. Robert Korstad, Director of the Initiative on Poverty and Social Justice at Duke University. Unfortunately, Mr. Jim Johnson had a death in his family and was not able to join us this evening, though we hope to keep his thoughts, opinions, ideas, etc. as part of the discussion. To open our neighborhood panel, please welcome Ms. Jade Buteau.
All right. Well, hello. I am Jade Buteau, the assistant. How's that? All right, the Assistant Site Manager at Historic Stagville, which is located just 10 miles from where we sit tonight. And if you're not familiar with Stagville, it was once a 30,000 acre plantation owned by the Benahan Cameron family. And this plantation held over 900 enslaved people in 1860. Making this the largest enslaved population in North Carolina. And in fact, the population here is going to rival plantations in the Deep South. And on our current site today, we have a large number of buildings, but probably our most prized are 4 original slave dwellings. These are 2-story slave dwellings, and if you haven't been to Stagville, I'm going to do a quick plug. You should definitely come out to see them. They're not typical of what you would be expecting. But these are some of the only original slave dwellings remaining in Durham County. And even though there were once dwellings across this region. And slavery, it's a history of brutal violence, of rigorous segregation and disenfranchisement of people of color. And this is the story that we at Stagville work to tell. And this is a reason as to why the site is being preserved today. But we also, in addition to that, try to tell the story of what happened to newly emancipated slaves and their descendants over many generations. Like there were 900 enslaved people at Stagville. What happened to them after April of 1865? Our interpretation doesn't end there. And because Durham was founded in the wake of the Civil War, many residents disassociate this history, so the history of slavery at Stagville and what happened, from the history of slavery in North Carolina. And even though we are on the outskirts of the city of Durham, the history of Stagville is closely connected to Durham and its neighborhoods. Emancipated people from Stagville became sharecroppers, small farmers, and wage workers, many of whom moved into Durham in the wake of emancipation. Some of them were also skilled craftsmen. Location at Stagville was referred to as Shop Hill on historic maps that we have of the area, is where enslaved craftsmen worked and lived. And so these men and their families are going to be moving into Durham, playing a big part as to how the city develops. And these farmer slaves and their descendants became integral in the formation of Black neighborhoods, of businesses and churches, many of which still exist today. Haytide's history includes names like Amy, Justice, Jordan, Cameron, Jones, Meeks, and Sowell, all families that came out of slavery at Stagville. And many of these descendants and their families still live in Durham, often in historically Black neighborhoods. And in fact, through not only the slave lists from the Cameron family papers, but also from descendants that are from these enslaved people that are still remaining in Durham, we have been able to create a genealogy database that traces the majority of the 3,000 enslaved people who set foot on the Benahan Cameron land from 1787 to 1865. So those 3,000 names to people still living today, to their descendants. So we have, so these names are appearing in the history of not only Stagville, but also the history of Durham, and we have documentation to prove all of this. And the buildings at Stagville tell a story of resiliency and strength of Black communities in Durham through the present day. And in our panel tonight, we are going to hear about the challenging present and future of communities in Durham. While what we are describing at Stagville, at our historic site, may not be an immediate part of these discussions, it provides a necessary context for such discussions to take place, remembering the past of our city, of Durham, and the past of its people before they ever came to Durham, adds resonance to these discussions. Thank you.
Good evening. It's really a great pleasure to be here and be a part of this community conversation. You know, when I think of, I forgot they were going to talk about Stagville tonight because I've spent a lot of time at Stagville, and actually I spent the night in a slave cabin at Stagville. And so I guess some other people here have too, because there's a national effort underway to actually preserve the homes of the people who built the plantations because they're like falling apart. And really, some of the buildings at Stagville, some of the larger slave cabins that are still there, and of course that great big barn, you know why they look so good? Built so well, better than my house today, because they were built so close to the 1860s because they didn't think slavery was going to end. They were still building. That's why that barn is still there to this day. It is standing so grand, and it almost makes you think of the effort and the time and the money, I guess free labor that went into that structure. It makes you wish that some of the people in this neighborhood and others across Durham could even still afford to live in their grand homes that maybe their grandparents or great-grandparents, built after that time, because there's some beautiful homes in Durham. Some of them are crumbling and falling apart, and some of them have been rebuilding, are going for almost $500,000. And that's problematic in its own right. But when I think of housing in Durham, especially coming here, I was thinking of Ann Atwater, and if you know her as the civil rights leader that she became, but I don't think she really wanted to become a civil rights leader. I just think, she had no electricity and her house was falling apart. And this was in the 60s, it was awful, her home and a lot of other people's homes. So she started, working with the Operation Breakthrough folks in order to really get the civil rights movement going in Durham. And, it's always going to come back to housing and healthcare, I think, pretty much, which will determine how well we live and how well our children live. And so I guess with our distinguished guests here today, first of all, I would like Professor Korstad to really talk about some of the history of housing in Durham. It's kind of hard to, sit here and not talk about Highway 147, and at least structures like this were spared, but as fast as this area is growing, it's still a very large population that lives in poverty, and still don't have the housing that they need. I think I saw, when the Housing Authority in Durham's, really got underway a long time ago, like some of the first things that they did is they built Few Gardens, and they built like McDougal Terrace. Well, Few Gardens is gone, but McDougal Terrace is not gone. And there's a member of my church that when I visit her, sadly, you have to go through McDougal Terrace to get to her neighborhood, where people have lived a very long time and owned their homes. And I think even, it's just not sometimes a happy situation. But Dr. Korstad, maybe you can give us a little history,
Okay.
to put us in perspective.
Okay, sounds good. Thank you all and for everybody who organized this. This is, I think, a really important neighborhood discussion, because housing is an issue that we all have to deal with, and it's something that's changing very rapidly in Durham and affecting a lot of different people in a lot of different ways. I just want to talk a little bit about a project I'm working on right now and how it fits into this larger discussion. In 2019 is Durham's 150th anniversary, or the sesquicentennial. Good, you're better at it than me. So we've initiated a new project out of the Sanford School at Duke and the Samuel Du Bois Cook Center called Bull City 150, Reckoning with Durham's Past to Build a More Equitable Future. And what we're trying to do is to look at a variety of disparities and inequalities that exist in Durham today in housing and education and employment, municipal services, criminal justice, education, health, and try to understand the institutional, this kind of structural roots of those inequalities. Because people in general, when they're polled in the United States, look at an issue, say like wealth inequality, which people have been working on a lot, and they attribute wealth inequality to the success of some people and the failures of others. It's all looked at in this very individualistic way. But if you look at the studies that have been done on this particular issue, it actually, individual behavior and even kind of family behavior has very little to do with the accumulation of wealth and the racial wealth gap in the United States. It's all very much embedded in public policies of the past and structures of the past. And this is nowhere more true than in housing. So one of the things this project is trying to do and believes is that any of the solutions that we might find to address the housing challenges of today have to be built on an understanding and a communication about the structural inequalities of the past. We have to change public opinion, change the understandings of policymakers and politicians so that they appreciate and understand how things got to be where they are. And so we're, one of the first things, we're going to do this project through a number of exhibits that'll be kind of museum quality, but also I've got some young people working with me, so we're doing pop-up exhibits and all kinds of other clever stuff that I would have never been smart enough to think about. So we're really looking at all these structures and this history in Durham, and I'll just mention a few things, and we can move on and talk about this more. But one of the things that we've are starting to uncover is through in the deeds office is that in Durham, virtually every white neighborhood and every white development from the 1920s well into the 1960s had racial covenants in the deeds that forbid people to sell their land, their house, to people who are African American. Duke and Duke Forest had that from the earliest houses. They continued to write those on deeds into the 1960s, even though in 1948 the Supreme Court declared racial covenants unconstitutional. Duke didn't take those off of the deeds until 2006. And what's interesting is, you know, whether it's Forest Hills, Hope Valley, Trinity Park, Watts, Hillendale, every one of those neighborhoods, you know, every house had a racial covenant on it. But what's also interesting, and we found in the last few days, is that even smaller, kind of more working class, lower middle class neighborhoods that start springing up in North Durham or West Durham, well into the 1960s, we're talking about 800, 750, 800 square foot houses had those same racial covenants that they had in Hope Valley. So what is the kind of historical impact of that? It's, you know, another policy that's implicated in all this is obviously redlining, which is some phenomenon of the late 1930s, in which certain neighborhoods in Durham on the map were, there was a red line drawn around them, and they weren't recommended for home loans by banks and mortgage companies. If you look at housing statistics in terms of the wealth of housing or the value of housing in Durham today, they track virtually perfectly with those red line maps of the 1930s, still to this day. And then you take other public policy issues like the GI Bill, which disproportionately provided low interest mortgages to white service men and allowed for the whole process of white flight, white working class, lower middle class flight out of Durham. So if you never mind urban renewal and the destruction of Hayti and a variety of other neighborhoods. So the point here is that public policy, as well as private action, is implicated in everything that exists in Durham today. And if you look at the landscape, the neighborhoods, even ones that are changing, if you kind of dig back a little bit, you can't understand how those places got to be like they are without understanding the way decisions were made in the past, the way certain people were benefited and certain people weren't. I'll just say one more thing, and then we'll have some more conversation. But one of the big aspects, one of the big points of this project is to really take head on the issue of white privilege. Because, you know, that's what public policy has been about. We can look at the way it disadvantaged some people, but what most people don't understand are all the ways in which they have been advantaged. Take Duke Forest as just a good example, where the university sold lots to faculty members and senior staff people at cost. They could take out second mortgages. They didn't, I forget what the process is, but they could borrow against the land to build the house and to mortgage their house. The university put in all the improvements, sidewalks, sewer, water, all these other things. Just think of the incredible step forward that every faculty member who bought one of those houses got, that didn't go to any of the staff members, the majority of whom were African American in the 20s and 30s and 40s and 50s in Durham. So, and there are multiple neighborhoods that you can look at the same phenomenon. So I think the point of this project, and I think the point of the work that we're doing, is that moving forward on a whole variety of issues of inequality requires that we go back and really understand the historical roots.
Thank you very much. I thought I knew a lot, but I did not know a lot about that history and the redlining here. I know Mr. Filippo, did I pronounce that right? Filippo, I mean, I don't know exactly how long you've hit at Preservation Durham, but I hear you've been working pretty hard at, and I wanted you to talk a little bit about, of course, Preservation Durham, but the Preservation Equity Project that I know that you're working on right now.
So thank you. So I think, when people think of preservation, historic preservation, there's a very particular sort of interpretation of what that means, right? We often think of sort of large, grand homes that are being saved at enormous costs for a very particular demographic, typically upper middle, upper class, white homeowners, right? And so when I took over PD about 14 months ago, I guess, my background's in community economic development, working with small farmers across North Carolina, sitting at their kitchen tables, trying to figure out what to do. How do you make this thing work? And so for me, when I came on, there was sort of an inkling of an idea. Back in 2012, PD had worked with a graduate student at Central to look at all of the historic African American sites throughout Durham, right? To document them fully, to really fully understand all the historic sites belonging to African American culture. And it was a good step. And then the next kind of steps were kind of vague. It was, okay, what do we do here? Do we think about how we get more historically black neighborhoods on the National Register of Historic Places? That was sort of one, inkling idea. It's a nice idea, but it doesn't really do a whole lot other than, maybe put up a plaque or a sign, which is great, and we need those. But it doesn't help the community. It doesn't help the people in those homes in any meaningful way. And so I started thinking about, how we could find a way to really make preservation more equitable. What do we need to do to make that work? How do we even begin that work? And so I looked around the country trying to find out whether there were any other cities who were doing good work in this space. And I ended up in Cleveland early last year, and it was a really fascinating experience. I haven't been to Cleveland. It's really interesting, sort of inverse process of Durham, where a city built for 1 million people currently houses about 400,000 people. So just imagine that vacuum of just giant mansions and factories completely empty. But they recognized about 15 years ago that white flight had kind of not only helped this process happen, but had never really shifted in any way, right? You had suburbia develop into a massive sprawl outside of Cleveland, and people had left all of the historic neighborhoods. And they were trying to figure out, how do we get people back into Cleveland? What do we do? What do we need to give people for this to be a reasonable choice? Knowing full well that it's quite an undertaking to, move into a historic home. It's a lot of work. And so what they did was they figured out that people needed knowledge, technical assistance, and financing, right? It's pretty simple, actually. Those are the two things that people needed to make it reasonable to buy an older home somewhere in Cleveland and regenerate people into Cleveland from all different backgrounds. And when I first went out there, I was pretty skeptical, honestly. I thought, honestly, it would be a lot of people that looked like me, buying historic homes and taking advantage of this. I was really concerned about that. I thought it was going to be something that was used, as a tool for effectively some type of gentrification process. And I was incredibly amazed to see that actually by simply empowering people and giving everyone access to the same tools, they were able to effectively create better equity in their neighborhoods. And so over the last 15 years, they've had huge success. They've lent about $50 million out in these low interest loans between 1.5 and 2.5% interest rate. So very, very low interest rate loans, making them as accessible as basically is possible. It's also a market-based solution. It's not a grant, right? And that's really important, There's a lot of grant programs that have existed over the years around housing, somehow connected to housing, but they're not sustainable, right? We can all see right now, based on the administration that we have, that there are enormous challenges with putting forth a program that relies on some sort of grant funding, right? And so what they did was kind of really clever in that they partnered with the local bank and they partnered with the Housing Finance Agency of Ohio. And not to get too technical about how this all works, but basically the Ohio Housing Finance Agency really needed to find a better market solution to get people to retain their homes and stay in home ownership, right? And they hadn't really figured that out. They had a lot of programs for under 60% AMI homeowners or renters and people trying to buy homes, and there were some programs out there. But for people who really wanted to stay in a home and maintain a home, there wasn't a whole lot. And so they basically all they did was move a bunch of their money into the main bank that was lending, Key Bank, which is based in Cleveland. And so that helped collateralize the loan. And so Key Bank said, okay, now we can offer a 1.5 to 2.5% interest rate loan. And then on top of that, there was the knowledge piece, which in all honesty is kind of more important. Most people, no matter who you are, don't have experience remodeling a home or rehabbing a home or doing any of that, or have the time to manage a person or yourself to take off work to do that work, to do all of the things that are required to renovate a home, right? It's an enormous privilege to have access to the time and resources to be able to do something like that. And so by creating a system where the nonprofit, our equivalent out there in Cleveland, offered free, impartial technical assistance to anyone who wanted it, it allowed an enormously diverse swath of people to actually buy and retain historic homes in Cleveland. And it really was wonderful to watch. And I went on site visits with them to really explore this and see, okay, who are these people, right? What is this actually working? And I'll just give you one snapshot. There was a woman living in the Detroit Shoreway neighborhood, which faced, like many of Cleveland's neighborhoods, a great amount of white flight and disinvestment during the 70s, 80s, and 90s. Was pretty close to downtown, so was slowly kind of seeing some form of revitalization, commercial districts kind of coming back online. This woman who owned this house was mid-60s, African American, raised 5 children predominantly by herself. She bought the home back in 1979 with her husband. He died in 1981. So she raised her 5 children in this home pretty much by herself. She held on to this home by the skin of her teeth, working with her church and her pastor. She almost lost the home on several occasions. In addition to this, back in not too long ago, in the 1990s, she had a neighbor behind her who had bought the house. And Cleveland's really strange in that the houses, many people own 2 homes. So you'd have one home and then a house right behind it, right? And families would own both these homes. And what happened with sort of this white flight sort of reconfiguring of these neighborhoods, working class African Americans would buy one home. And then someone else would buy that other home behind it, right? And it shares a driveway. So imagine this is really not, it's kind of an interesting situation. The guy who bought the house behind this woman bought it for his mistress, and so there's that. And there was a lot of stuff happening in this house. And he was incredibly racist. And he would yell all sorts of racial epithets at her at a regular basis. It was a horrible situation. It was so bad that they had to go to housing court, and a judge actually had a bollard, which is one of those big posts that you don't back up into a building, in the middle of the driveway so that neither of them could use it. It was really, really just an incredible account. At one point, a baby was thrown out a window. They survived. It was really, really challenging living in this situation. So this woman lives there. The neighborhood's revitalizing slowly, but she hasn't updated this house in 36 years, right? So here's kind of the rub, right? She's aging. Her 5 kids are going to question whether or not they can keep up this house, right? The costs to keep her in the house are going to increase. There is a situation where you already see all around Durham, and this is all around the country, where you're going to see signs that say, "We buy houses," right? U.S. speculative investment. That's already happening all over the place here. In many of our neighborhoods. And what happens is, especially, the most vulnerable population are those who live alone, who are elderly, who are typically women of color, right? Who are already the most vulnerable people in society. And so what do we do, right? How do we find a way to make this something that isn't devastating to our cities, to the individuals that live in these homes and neighborhoods? Because if they aren't able to make the kinds of repairs that are necessary on this home, right, they're going to get swindled. They're just going to. That's what's going to happen. It happens over and over and over and over again. People who do the repairs will do them poorly. They will overcharge them. They will leave the project. They will never call them back. We get calls about this all the time, even at Preservation Durham. So, by providing her free technical assistance and this low-interest loan, she will be able to, for the house that she bought for about $9,000 back in 1979, which is, she will be able to, for probably around $30,000, remodel the home, do all the updates that make it safe and clean and good for her to age in place. That's one of the most important aspects of this, right? Because the longer she can stay there, the less expensive it is for the family. Retain that asset in a minority family's hands, keeping that wealth in that family, right? And when she chooses to sell, or when she chooses to pass it on to her family, they can get a fair market rate for that home, retaining that wealth in the family, right? And so that's what we're trying to do here. We have partnered with North Carolina Housing Finance Agency, Self-Help Credit Union, and we are trying to raise money for staff to make this a reality. We're up for a Triangle Community Foundation Award in, a few weeks. So hope that we win that. But we recognize that homeowners across Durham, again, predominantly older homeowners who have lived in their homes for over 50 years, or have homes that are over 50 years old, especially those who have lived there for most of their lives. Again, if you look at the demographics, are typically older widowed women, right? And of those, many of them are women of color. And again, they're the most vulnerable. So how do we make sure that folks are able to stay in their homes and retain the fabric of neighborhoods in a changing Durham? And we're hoping that this is one tool that can help do that. And so again, we're really hoping that by lifting everyone up and giving people access to similar resources, that we can retain folks in their homes in a majority-minority city, retain Black wealth and assets, and protect our historically African-American neighborhoods more than just the homes, more than just the name of the neighborhood and the historic significance of the buildings, but actually retain the people that make that neighborhood a place, because that's the most important part of that. And so, that's what we're working on, and we're really hopeful, that we can make it work.
Well, I know Professor Jim Johnson from Kenan Flagler Business School couldn't be here, but that's what he spent the last several years working on, research, taking a closer look at aging in place because it's such a large part of the population. And one of his papers, he says that nowhere in the U.S. has elderly population growth been more apparent than in the Carolinas, like North and South Carolina. Most of the aging people somehow live here. And there are a lot of elderly single women. And that brings about issues of not just their housing, but their economic status and their health care and just about everything. Because if everything isn't working in that circle of life, then the housing is almost the last thing you think about, and it's probably the first thing you let go when you're trying to take care of everything else. And I know, Ms. Hill, you work in that arena in many ways, and maybe you can talk about, I guess, how important it is, for all these aspects to work together, even when we think of housing. Sometimes, it's hard to make people realize how important it is to keep their home if they cannot take care of their other needs. And healthcare is like one of those needs. And I wonder how, how those two issues fit together. I mean, especially in a community like this. I was just speaking to a relative, and because I'm probably the only person in my immediate family or even wider that even lives in this area. And I was like, well, I kind of had to move to the area because they had some specialty doctors here. A lot of people have moved here for that. And it is not easy. And I see those people even at Duke Hospital, with their children all the time, trying to say, like, do I have to move to Durham just to have a good doctor? I mean, it's all intertwined. So maybe you can speak a little on that.
Yeah, so traditionally when we think of health, we think of doctors and hospitals or clinics and nurses and the delivery of care. And what we're moving into for quite some time now is the fact that we need to think about health in terms of social determinants of health, knowing that we are not going to doctor, hospital, or clinic our way to better health outcomes in general, that we have to really think about communities that maintain people in good health through prevention or just because their wellness can flourish in the communities in which they live. And so what we're seeing, most of the work that I do, and I should just go ahead and say that my opinions tonight are not the opinions of the Kate B. Reynolds Charitable Trust. So I am speaking as a community member and a person who loves Durham, and is Ben's neighbor. What I would say is that in what I do, I travel throughout all of North Carolina, and I'm sitting at tables with very odd partners, people who did not think that they'd be having conversations with each other. Hospital executives, the directors of federally qualified health centers, speaking to their local housing authorities, to their chambers of commerce, and to a variety of other housing and community advocates to try to figure out exactly what they're going to do about a very critical social determinant of health, which is housing. As one might suspect, it's very difficult to administer treatment to people who have some delicate needs if their housing is not in a manner in which they can maintain their health. And so these hospitals and clinics are having to get into the conversation because they're already paying for housing in ways that are very expensive and not very efficient. They're having to provide a lot of critical and acute support by, paying for motel stays, trying to figure it out with, hotels or faith-based networks, because people's housing, if you have, issues with plumbing or electricity, you can't maintain warmth in your home, or your roofing is bad, then you're not likely to have very successful treatment if you're a COPD patient or if you have asthma, all kinds of different conditions that you would not want someone in certain conditions to return back home to. And so they're having to try to think about some creative things. In some parts of the state, I've even seen some people who are trying to think about how to take the resources they're currently spending on these, Band-Aid solutions and doing things like tiny home villages that are close to the hospital or clinics so that folks can actually, do their walks at the supervised gym, come to the hospital for certain food menus that keep them on very strict, nutritional values for their diet. So all kinds of things people are already trying to do to be creative and get around the fact that we have a market that isn't really treating those of us who are most vulnerable in terms of health very well. Because as you know, healthcare is getting to be very expensive. And so for those of us who know that, we just met with the new director, well, I just met with a few folks, the new director of the housing authority here, and when he describes affordable housing as 30% of your income, I had heard that before, but what I had not realized is that's supposed to include utilities as well. So the 30% of your income is supposed to include your mortgage or rent plus your utilities. And I think about the market in Durham specifically and what it means to be a low-income person and what our current rental or housing market looks like here. And I just know that lots of people are being squeezed down. You couple that with the fact that people are looking at hundreds and hundreds or maybe thousands of dollars for their care every month. And I just don't see how people manage competing needs. And so when I'm visiting at the diabetes clinic up in northern Durham, I know that people are making the choice to skip treatment a month here or a month there, which makes their care very unmanageable. And then what we see there is people going to the emergency department to deal with the crises that follows because people have tried to move the budget around and be as responsible as they can to not miss their housing. So in many times we're asking people to perform very heroic, crazy, financial gymnastics to constantly play this game right on the edge of a fence to manage maintaining their housing, and then things get bad enough and they have to, cut out rent for a month and go take care of some medical needs, and then back and forth they ping pong in the system, and we see, the clinics trying to figure out how to coordinate care and resources, but it's just not. We get a lot of requests for care coordination so that the patient isn't having to take on the stress of figuring out the food pantries, the housing, the transportation, the legal needs that they may have around whatever's going on in their life, because all these things are piling on top of them all at once. And that to me does not speak to wellness. That set of dynamics and stressors to the patient, I just don't see consistent and community level success through consistent juggling of these inequitable systems that we have set up. My belief is that we know what it takes to make communities and people in them well, and to house them well, and to educate them well. We just don't apply that knowledge equally across our demographic. You mentioned the GI Bill. There were lots. We knew how to lift, and not even just the GI Bill. We know how to lift people out of poverty because we did it for white folks. We've been doing that for white folks in this country for a very long time. We know how to make sure that people can access homes because we've been doing that for white folks for a really long time. And so what I want to posit is that nothing that we're seeing is insurmountable. It was all very well designed to get the outcomes that we have. I would also posit that the redlining maps, and it is indeed true what the professor said earlier, that the redlining maps, and actually they're online, so you can look up Durham and redlining maps, and there are some websites that have gone ahead and scanned the original maps that were used by the banking industry. You can read their memos that describe the exact specifications for why a neighborhood was determined as red, yellow, green, or blue. And they are strictly correlated to the percentage of African American people found in each of those communities. And if you overlay those maps with current day maps of Durham, you'll find that the maps that had the least amount of investment through bank loans to purchase homes and to make businesses correlate specifically to the current socioeconomic status of those communities. So the neighborhood that Ben and I live in was a redlined community way back in the day, and it only took, I want to say, 5 to 7% of the population had to be Black for it to tip your neighborhood as being unfavorable for investment. 5 to 7% of the population in a particular area. And so our neighborhood was redlined by the banks, which meant people could not access capital to purchase businesses or homes in my neighborhood. And right now, as we currently stand, my neighborhood is the poorest census tract of Durham. So that correlates perfectly. We know also, there's a really great video that I want to refer y'all to called Unnatural Causes. And they have a snippet of a little part of their video. It's a longer documentary, but you can probably find the one snippet in there that talks about how the greatest determinant of your health is the zip code in which you are born and raised. And so I think that that's fascinating, right? And then let's take it a step further, that zip code is so important. David Dotson, I was listening to him do a presentation the other day about the connection with economics and health. And David Dotson is over at MDC. And so the issue is not just where you were born, but the fact that depending what socioeconomic status you are, wherever you're born, that there's a sense of stickiness to that status, and that we have not just an issue with equity, we have an issue with mobility to get people from one class to another. And so we're seeing that if you're in the lower 20th percentile, you're gonna have a hard time getting anywhere no matter how hard you try. So let's combine where you're born being a huge determinant on top of the fact that your class means you're more likely to be poor if you were born poor, right? And so you combine all those things and it feels like a really hopeless, situation. But again, let's remember, all those things are by design. Well, overlay the map that we currently have of socioeconomics for the neighborhoods in Durham, and you can pretty much determine the concentration for poor health outcomes in Durham. And so these things all correlate together. One thing that I want to say UNC's website also has this. We're talking about housing, but I want to be clear that housing isn't just about the structures. It's about the people, and it's also about some of the other amenities and features in a particular community. So we also need to talk about the environmental toxins that can be found in a particular area. We need to talk about noise pollution and light pollution. We need to talk about the way communities are policed. All these things impact health in a particular neighborhood. I know that there was a season in time in my community in which I could not enter or exit without passing a police checkpoint. And that militarized reality is what I endured, and many of my neighbors endured, for quite a while until, enough complaints came through and then they knocked it off. But, it always transitioned. Our neighborhood was referred to by the police department as the bullseye. I don't exactly know how that, I can pretty much assure you that kind of a mentality, mission, or naming of a community does not make one well. And I know that for a certainty that if we were to name the bullseye as, overlay the bullseye and that initiative at the police department over a community such as Trayburn or Trinity Heights, I know that would not go over very well. Mm-hmm. But we were asked to accept it and do it with gratitude. We were to be thankful for these kinds of efforts because we were being saved from ourselves. So, you often also see a high concentration of services that when we put them too close together are actually dangerous for the community. Not because they're dangerous in and of themselves, but because the high concentration of them together is not the intention of those individual institutions. So what I'm referring to are things like group homes, homes that are meant to support folks who are recovering from addiction. And so I moved into my neighborhood well aware that there was a Durham Rescue Mission. I am perfectly fine with the Durham Rescue Mission being there, as long as it understands that it is a part and a piece of a thread in the fabric of a community with lots of dynamics. But when organizations like it and others like it want to tip the balance of the community to be more overtly service-oriented for one population and one kind of population only, that is also not something that I think inspires wellness for a neighborhood fabric. So, but as far as the environmental toxins go, I know that here recently there was an email sent to residents of our community to talk about permitting. There's some things that DNR requires facilities to do in terms of filling out paperwork and registering to make sure that they're following certain rules and compliance. I know that Northeast Central Durham has a higher concentration of these facilities than many other parts of Durham, especially of the low-level polluter range. I think we have like 5 out of 7 or 5 out of 11. It's an intense amount that are all concentrated in an area. And the email talked about the fact that they were petitioning that because there were beneath a certain level of how much toxin they exuded, that they wanted to be released of this paperwork and all the fuss, and that because they were they weren't big shots on the list, that they didn't need the oversight. And I just think about what that means for those of us in the neighborhood if that kind of oversight and regulation and opportunity for them to check in with regulators goes away, given that we have so many of them. And me personally, I'm right behind the railroad tracks, so all of them, I live right back over there, and so they are all butting up against my home. So there's lots of different layers to this. It's not just the house and the lead and the roofing and the insulation and things like that. It's also the policing, the environmental toxins, the noise, the availability of jobs and transportation nearby to your home that impact the whole mosaic of someone's life and ultimately their health. And so these are all issues that philanthropy is struggling with, quite frankly. As you can imagine, most of our funding at the Trust is focused on rural communities. But the challenges that Durham has, we repeat them constantly from community to community. And, for us personally, I know that our document that guides our mission was written in the 40s, and what health-related organizations that maybe got started 50 or more years ago thought of as what needed to happen for health, right? So Mrs. Reynolds, in her foresight, if you wanted to help people with health, you built a hospital for Black people because there weren't hospitals for Black people. Insurance wasn't even a thought. And now we have different safety nets, but we have to re-envision what it means to be impactful in health. And I look forward to the evolving conversation around what it means to think about economics, to think about housing, to think about the way a community wraps around a person and produces their health for them. So
that's very important. I know I wanted to take some time to allow the people in the audience to ask questions if they have them. I don't think we have a roaming mic, so I would need you to speak really loud. But one thing I think about often is many of us, I guess, in the room live in Durham, and we know why we live in Durham, and I guess we like Durham, but whenever I speak to someone who's moving to the area, they tell me when they call realtors, they never refer them to move to Durham. They tell them to move like anywhere else. I'm like, what? I can't believe that. But they say that happens and has been happening a long time, and it continues to happen. So it's like amazing. It makes me think, there could be a lot of factors, but maybe the age of, the housing stock, when we think of revitalization and the availability. I know every time I turn around, there's a new neighborhood being built. I don't know how sturdy those houses would be because they're going up mighty fast. But I just wonder if that's good or bad? Is that a curse, Robert? Or, do we want more and more people to travel that are moving from, and a lot of them are moving from New York and Pennsylvania, just coming straight down here?
I'm a New York transplant.
Really? And so, but they say nobody recommends, they're like, oh no, move to, Morrisville or Apex or Cary or somewhere else. So why do you think that, Robert? And if anyone else has a question, raise your hand so we can.
Having been relocated here by a company, the realtor that was assigned to help me, never brought me here, and I was coming from Santa Monica, California. And I said, I'm used to walking to my local Indian restaurant. I'm used to going down the road 2 or 3 blocks on my bike and going to my local Japanese restaurant. I said, where's the flavor? And she said, oh, you must mean Durham. So,
And then you ended up moving here.
yes, I did, because after looking in Raleigh and Cary, it was very cookie cutter and very white. And I was not interested in being back in that environment. But if I hadn't said something, they would have poked me in one of those places.
I'm sure they would have.
I have a question.
Yes.
Does Durham have a nonprofit housing developer? The first community development corporation in this country was funded by Ford. It was headed by Nathan Garrett, a local accountant whom I knew, right over there on top of Hill Street. If you don't have a nonprofit developer, you're probably not going to get much low-income housing or affordable housing.
Durham Land Trust.
Is that what self-help is doing?
No, it's, it was part of the North Carolina Fund, or the aftermath of the North Carolina Fund, community, I've forgotten what the name of it was, that Nathan Garrett was, Foundation for Community Development. And there were, there was a combination of funds coming from the Ford Foundation to help start and develop and maintain black business, and also housing for in black communities too. And it was, I think it was something for a period of time that was pretty successful, but it was like any of these other things. After a while, the funding ran out. It was very difficult to get, because of some of these structures that we've been talking about, financing from the private sector. So, it's one thing when you've got banks or governments like Cleveland. We'll see whether Durham does similar things, that are providing these low income, low interest loans, providing help in terms of fixing homes up and doing things like that, whether those kinds of things can be sustained. And I think that's one of the things we see with a lot of housing policy, is they last for a few years and then they're withdrawn, or there's a lot of there's money put into thinking about doing certain things, and then the money goes away. And the problem is that over generations, the kind of equity that's necessary for people to build wealth is just not available. I can see. I think there were some very innovative aspects of that. I've written a book on the North Carolina Fund, and there were all kinds of fabulous things that they were doing, and most of them in the end were pushed back by political forces in North Carolina and Washington that saw the kind of empowerment, financial, political, and otherwise, of African American communities as a real threat, and in the process changed a lot of laws and regulations to make that more difficult. So I think that's another thing that we have to interrogate, is just the kind of impact, whether it's philanthropy, whether it's federal funding for different kinds of projects or not. But that's, I don't know if Ben might have something to say more about that.
No, just something you said sparked my. I want to be clear, though, that nonprofits and philanthropy can only do but so much, and that there is no substitution for good government policy. And we've already seen good government policy, again, get white folks into housing, get white folks well educated, and get white folks healthy. So we just need to be clear about that. I will say that you mentioned the land trust, and so I don't know if anybody else has any, because this is a room with a very deep well of knowledge, and so if anybody else has any nonprofits to answer this gentleman's question that you want to direct him to. Housing for New Hope, rental development. CASA. Lovely.
I'm pretty excited about the recent development of City Council Durham, who voted to go forward with a partnership with self-help and DHIC, I think is the name of the architect and design firm, to build affordable housing on that tract of land by
Yeah.
the transportation.
Yeah. So for those who aren't aware, Durham Can and a variety of other community organizations have been working on getting the city to be willing to use some land that they own right behind the transportation hub and next to some other condos and a lot of other really desirable amenities in downtown. So that's prime real estate to develop that land for some affordable housing through self-help ventures, correct, that is the financier. And I know that some other folks have been having a conversation, well, probably some of the same folks have been having a conversation about not being so hyper-focused on downtown, given that there are poor people throughout the city who are trying to find a way to get to work, and that it'd be nice to think about a comprehensive view of having affordable housing in various commercial pockets so that low-income folks can get to these centers of employment easily and live nearby.
I mean, one of the issues with affordable housing is, you know, when you have a population in Durham, 17% of which lives in poverty, in the African American community it's 25%, going up to 30%, in the Hispanic communities it's much higher than that. I mean, you know, what is affordable housing? Affordable housing for people, you know, who make, you know, who live below the poverty level is like, it's like zero rent. I mean, that's what people can afford, is nothing.
Because I think the rent here, the average rent, they were like, it's like over $800 a month.
Yeah, I mean, people in these situations are paying 60, 70% of their income for their rent. I mean, they're not anywhere close to what the norm should be. So again, it's this issue, you know, how do you build all this affordable housing, which is always going to have some kind of you know, rent in which people are going to have to pay. If you've got a substantial part of your population that, you know, which we have, what, I don't know what the unemployment rate is, it's still pretty high, and well, it fluctuates in Durham. But if they don't have enough money because the jobs pay too little, I mean, that's you know, one of the problems with housing in Durham is this has always been a low-wage town. I was doing a study recently looking at the wages of African-American women who worked in American Tobacco in the stemming divisions, which was the majority of jobs for black women in the 1920s. The wage they made is equivalent today to $2.50 an hour. So that means they were working for a third of what the minimum wage is today, a sixth of what we think the living wage should be. And this went on for generations and generations. So, you know, one of the reasons people lived in poor housing, or there wasn't adequate housing 50, 60, 70, 80, 90 years ago, is because of the political power of white manufacturers, employers, that, you know, basically allowed them to have access to a labor force that which was difficult to unionize, although they did a pretty good job in Durham. But people, they didn't make a living. They didn't make enough money to afford housing. And that's still a big issue today. And I think that we, you know, that's something that people need to be talking about, because it doesn't, you can build all this stuff, but it's like Southside. I mean, you know, they built a lot of nice affordable housing over there, but I know Duke at least had a very difficult time finding people who had the incomes and the down payment to move into any of those places. Well, that's a good question. What is affordability? Affordability is, if you're making 20, 30, if you're working minimum wage, affordability in housing is not very much. I don't know what I'd calculate, $300 a month? Anybody find an apartment for that?
So there's two different buckets we need to look at. There's renting and then there's owning. And we need to get out of the fantasy that there's any such thing as affordable housing to own for people who are working for the low wages that we know exist throughout Durham. So that's the first thing, right? So access to capital for low-income folks is the big stair step, and that's a conversation with banking and its practices. I recently went to a workshop in Raleigh about banking, and they tried an experiment. So a philanthropy backed the bank for a certain amount of money and said, make loans to low-income folks and make them low interest, and don't require a credit check or any of the other things that banks tend to run people through the ringer for. So they did this. I want to say the loans were $10,000 to $15,000 a piece. They were all unsecured loans, so they didn't have to put up an asset to get the loan. But the bank was willing to entertain it because there was someone who was backing the money. So there's a experiment. They're running it. They have all the loans out. Not a single loan defaulted. And that's a really big testament. And I thought about that in that audience when I was thinking about that, how is that possible? Because I know that people struggle and that there's so many competing demands for such limited dollars. And then I thought about the fact that, in my neighborhood, I know that there's a lot of people who make very meager wages, and yet they pay an extraordinary amount for rent, and that their rent is the first thing they try to make sure that they pay. And so my curiosity, my brain wants to find a nexus between a conversation of what banks are willing to do with the realities of, what poor folks, what crazy heroics poor folks pull off all the time to make ends meet. And wouldn't it be great if those heroics actually got them some equity in a piece of property that they get to own, right, and that they can leverage for loans to put children through school, or if there's an emergency, they have an asset that they can borrow against. I mean, this has a trickle effect in so many different ways. But the reality is that right now, there are so many people who have to sit on the bench because of the practices of the banking industry. I'm also really clear that when we look at the data about when banks are willing to loan to folks, and again, we know how to make white folks well, we know how to educate white folks, we make sure that those folks are taken care of. And so yet we see these practices happening in the banking industry where folks are more likely to get these toxic loans, higher interest rates, being more likely to be rejected for a loan altogether if they're a person of color. So that's still going on today, to this day. I thought it was interesting the last time I refinanced my loan that my information, I had been doing most of it over the phone. And so the person had not seen me, and I was marked as white on my application. And I really wonder if I had met the person in person, what the outcome of my loan would have been. Would I have been able to take advantage of the lower rates that the banks had available? And so after my loan was approved and we were just finalizing some basic things, I had her correct the information on that little part of the form, because I want my loan to count towards the other statistics, like please lend to black folks. See, we got this. But I think that when we're thinking about affordable housing, there's what's affordable based on ownership, and then there's what's affordable based on renting, and we need to be able to do some affordable renting as well, given the fact that if folks have to move around for better paying jobs, the transience of low-income communities requires that flexibility in housing.
One thing, and of course we don't know how long we'll have Social Security, for example. I know this seems like I hope we have it a long time. But some smart folks at Columbia University in the Melman School of Public Health, they're actually pushing for some type of policy to actually allow people to get their Social Security much earlier than they're allowed to get it. I guess you can get it at 65, and if you just wait to 67, you may even get even more. But they were like, no, they should be getting it like at 50. I mean, when you think of the amount of time that people work, even sometimes on their hands and knees for so many years, they may not live to 67. And just think what they could have done with the money that's been taken out of their checks since they were, 18 or younger, what they could have done and invested even with that. So you would think there would be some big government policy school coming up with this, but no, public health. The School of Public Health is saying, how that could change lives. Maybe that could help pay for whatever they want it for, but people should be able to get their money earlier. That's what they're pushing for. You don't like that? Huh?
So the thing is, when it was originally created, it was a program that people didn't think a lot of folks would use.
Right.
I'll just be really honest, because the age at which you collect was actually beyond the average lifespan of the American at that time.
Yeah.
So we were thinking, and people were not living as healthily or as long as they are now. So the idea was, if you made it past 50-something, and I don't want to sit here and tell fables about the exact age markers, but I know that the age at which you were supposed to collect was actually after the average lifespan of an American at that time. So the idea is, if you made it to that age, you had to be ancient and really ill and needed to be supported through this program. So that was the thought process. It was not something that people expected to collect. And so now we have a very different perspective.
That's a program that's also very discriminatory towards African Americans
yeah.
who have a shorter life expectancy. So basically,
That's what they were saying,
for
they need to
years
be
and
able to
years
get their
and
money.
years, African Americans have been paying into Social Security to take care of, my grandparents and stuff, or my parents. But I mean, the problem is we've got a Congress that wants to raise the age of Social Security. So.
Shit, that ain't one that exists.
Yeah, well, that's true. Yeah.
I know. There's a lady back here with a hat on, I think.
What about the attack of humanity model? Is there a lot of buildings going on in the area in Habitat?
It was
The Habitat for Humanity model. Yeah.
Yeah, so Habitat for Durham does quite a bit of work. Right now they're focused on Northeast Central Durham. I think their goal is something like 150 total homes in Northeast Central Durham. I think like any program, that's just my personal observation, there's a variety of issues at play with Habitat. As a baseline, they are providing affordable housing and home ownership, which is huge, right? I mean, it is an equity stake, and it is often housing for veterans and persons of color and single moms. So huge need. But there are some sort of basic issues with the way it's structured. One of which is a cultural and sort of racial stratification that occurs based on the model of Habitat, right? So if you look at the way Habitat operates, and this is pretty much nationally, there's very little engagement with African American churches, right? You will typically see a predominantly white church that is proffering up the volunteers who, in all honesty, while they do help with the homes, they do a very small sliver of what the actual work is. The employees are doing 99% of the actual building. So that's a misconception, But So there's a really big stratification there, and this takes place, especially in majority-minority cities. This causes quite a big rift between Habitat and local communities because the churches from African-American communities want to be involved with the process and have a stake in the process, as they should. And Habitat is kind of hands-off with that process. They don't necessarily allow for the full engagement of sort of the property by that, by the church. And so there's this sort of basic cultural rift that occurs there. And I think that's problematic because when you have Habitat operating in predominantly minority communities and they're not being represented by the actual building and the sponsorship of the homes. So there's sort of that basic social rift there that I think at some point Habitat's going to have to find a way to address. It is problematic even in our neighborhood.
And I'll just say the way their process works in terms of the wait list, right? So let's say you live in a rental that's like falling apart, you're paying way too much for it, you figure out and you get on the wait list at Habitat. You may or may not be given the option to move into a home into the community in which you've maybe lived for decades. So if the home that becomes available next, and you get the opportunity, I want to say, to pass on the home like 2 or 3 times, but the idea is if you want to stay in your home and engage Habitat for Humanity, not stay in your home, stay in your neighborhood and engage Habitat for Humanity, they don't currently have a process that allows you to match based on neighborhood or geography. You just have to take the next available in like a metro area. And that's a tough thing because part of what I think, like I said earlier, housing is about is not just the physical structure, but it's also the relationships. If you have figured out who can take care of your kids, who's going to drop you off to work, your desire lines, anyone in here understand what I mean by desire lines? Like where you walk to the coffee shop, where you walk to get your laundry done, things like that. Once you've mapped that out, to have all of that uprooted because you can't stay in your community of choice, that can be very disruptive to someone's life and the many ways in which they've worked to make their life work and run well.
Is owning a house as important to building wealth as it used to be, or is there other ways to build wealth other than owning a house?
Yeah, you can.
The primary way Americans have wealth is through their housing. I mean, not for the richest people, but 70–80% of the populations, all the equity they have, all the wealth they have is in their house. It's not in stocks, it's not in other kind of financial arrangements. So it's, in the wealth gap, the black-white wealth gap that exists in this country is virtually entirely the gap between white home ownership and white equity and housing and the lack of such in black communities. So it is the way that Americans have, since the World War II, have built wealth. And you have to remember that, prior to the GI Bill and suburbanization, most people in the United States didn't have any wealth. I mean, black or white or whatever. And this phenomena of people having retirement and Social Security, or a combination of New Deal programs, the public policies like the GI Bill, and labor unions. And one of the problems these days is that we're in an environment in which very little of that is available anymore to people. And it is true that once whites kind of made that big breakthrough and the kind of accumulation of wealth of my parents' generation, the baby boomers, the World War II generation, passed their wealth down. It's the public policies, whether employment policy, housing policies, health policies, social welfare policies that would be necessary for new populations or other populations to build similar kind of wealth have gone by the wayside. And that's why these are you know, these are political issues. These are policy issues. They're not issues about individual ambition or individual hard work or savings or education or any of those things. Unfortunately, that's what most Americans believe. 70% of Americans believe that that individual initiative is responsible for wealth accumulation. Yeah, right. And so
I'll disagree with that to an extent. Yeah. The real generator of wealth in this country is business ownership. The African American home equity that was taken, that was stolen as a result of the debacle with the banks, has resulted in a situation where by 2040, African Americans will have only half of the net worth that they would have had the financial crisis not occurred. That was basically stolen wealth that nobody has paid for. But the millennials don't believe that home ownership is going to be the boom that it was previously. And so I think that more Americans are skeptical about that today, as they well should be.
Go ahead.
They're skeptical because they can't stay at a company as long because companies aren't keeping employees that way. I mean, the nature of employment has changed. So people are more mobile, they're moving around a lot more, mostly by necessity. You know, the days of this generation watched their grandparents serve 20, 30, 40 years at a company, and then watch their parents attempt to do the same thing and get laid off with no gold watch reward, no kind of gratitude for making them, latchkey kids and have to be in all 1,000 after-school activities. People have just figured out my loyalty to a company doesn't make sense given how my parents were treated by the companies that employed them. And so they saw a lot of that. And so there's a lot of things around generational studies that kind of explain this phenomenon. And so part of the side effect of that is that owning a house feels like a really, really scary thing to do because you don't know if you'll be able to maintain employment to maintain it.
It's not a really good investment. The average house returns a net return of about 2%, which is the rate of inflation. When you look at all the costs involved, it's a wash.
I will just say to that point that a cash flow issue does anything. Oh, what's that?
Oh, that it
It's not a great return on investment, the house as a baseline. Yeah. But I will say that, as a cash flow issue, that is a major issue when you look at rent numbers nationally versus mortgage payments on a monthly basis. The cash flow issue month to month does change. So, assuming that there's very little capital or wealth to begin with, that can make a major impact on someone's life. And I'll just briefly say, if Jim were here, what he'd also want to say is that, to your point about business ownership, the highest growing rates of entrepreneurship are amongst three sectors. One is encore entrepreneurship, and that's Jim's term, so I didn't say that. Encore entrepreneurship, and this is 55 plus, right? Maybe worked for a while, hit the recession, whatever happened, starting their own business. They have the highest success rates of post 5 years of any other business owners. In that group, and more broadly, the fastest growing entrepreneurship rates in North Carolina, and it looks like many other places, are amongst women and people of color. And I think that trend will probably continue, and it's just something interesting to look at as it relates to sort of overall wealth and asset building.
You also have to look at public policies around even that. Think about all the destruction of all the black businesses in Haiti and the urban development. Look at the same thing that's going on right now in Durham with gentrification. I had a student who started working on this last year, and she decided not to do the project. But just looking at the increasing number of black businesses that are being forced out of the central business district, but with higher rents, other things are moving in. If you look on Chapel Hill Street, there's a thriving black business district there that won't be there in 5 years. I mean, it's just, you can just see one store after another being taken over by something that's catering to a very different clientele, or Duke is moving in, or self-help is moving in, or something. So I think that's an issue too. I think home ownership and small business. I mean, I'm a child of small business, and it was what got me through life, and people who are basically self-employed. But so again, it's all of these issues are part of a mix of a lot of different things.
So I'm curious about the expectation of the public sector. You talked about public policy, and we have a local government, city and county, that I think they've been pretty active in trying to come up with solutions. But the gentleman mentioned the whole job piece, especially for Black-owned businesses. Although we've seen growth, the number one challenge continues to be access to capital. If you look at who pays in Durham and who benefits in Durham, I mean, Duke has received a tremendous benefit in that they basically had almost, coming out of seeing the vestiges of slavery and seeing everybody move towards having cheap, if not free, cheap labor. Durham now is sort of a situation where the folks who have benefited from low wages are in a position to continue to enjoy their lives. When we look at what kind of jobs we can compete for in the Triangle region, I haven't heard anything yet that sort of gets to the reality that the market is speaking, and we have a lot of folks that are not prepared to work the jobs that are being created. We have the whole movement of the American underground, social entrepreneurs. They're doing fine. And the gentleman is right. They're not buying homes. I'm involved in development in downtown Durham. They're renting apartments. Their lifestyles are very different. But we got all of these folks that have benefited the wealth that has now been generated by folks that are not reinvesting. We got a local government that we're heaping more expectations on. They don't create jobs. We create jobs. So, I'm struggling with how to use this information and operationalize it. I'm also wondering, as a Black person, you're talking about my life, my experience. This is sort of what we do, And when we get a project, as developers or business people, it's usually the most challenging with the least resources to get it accomplished. So, Duke may have had a problem finding minorities, Blacks, to get those mortgages, but they certainly didn't have a problem finding young white homeowners, and that's what you have. So when you look at the gentrification, we are culpable in this thing. We have all of the good stuff we get cheap with cheap labor, that's all on us. We're getting what we pay for.
Yeah. I totally agree with you, and I think that the purpose of this project that I'm working on is develop a community-wide conversation on understanding the history of these inequalities and realizing that you can't just stop discrimination and then assume that everybody's going to be fine. There are going to have to be some changes. There are going to have to be some compensation. You can call it reparations. You can call it a lot of different things. Investments in education, investments in housing, investment in transportation. You can name in a lot of different ways. But there's going to have to address these issues. There's going to have to be some of that. And I think you're absolutely right.
It's almost time for us to definitely wrap up. And I want to know if there's a couple of more questions.
I was going to say directly to what, hey, Carl. One of the things that I know East Durham struggled with on a committee that we sit on working with self-help is, they were just given $700,000 by the city council. The issue that the community has is that and so what may not be known to the larger community is that, self-help engaged in a community-driven process where they asked neighbors to be part of the dialogue, to envision what the property would be. And so they were lockstep with us for a while until we said, okay, so here's the deal. When it comes to how you're gonna renovate the building and the vendors you're gonna use, and we wanna engage in a process of having some community agreements that you commit to.
Yeah, like if the building that MDC is located in downtown Durham, why couldn't we come up with a plan where a black-owned person that would create a certain number of jobs could own that building, have it secured, have it developed as a result of MDC coming into that space? That building is owned by self-help. The gentleman asked about the work that was created after the North Carolina Fund and Nathan Gary did. Well, we have UGI Industrial Park, 46 acres of land that is owned and controlled by African-American business people that came out of it. A lot of the nonprofit organizations that we have are actually in the position that minority businesses used to have because they're servicing low-wealth clients in a community. And so they figured out how to make it an industry in a way to build their resources, but that's also been at the expense of the innovation that black business people had to have because they had a captive market because of segregation. So unless you sort of start to move the money around so the folks that need it, and you pair them up with the ingenuity of the folks that have the technical assistance, similar to what they're doing in Cleveland, you're just going to get a group of people that benefit off of poor people sort of living more comfortably poor.
And
but
so,
they're still poor.
So what we saw is that their dollars were approved, even though the community spoke at that meeting in protest to the fact that they had not made these community agreements yet. And so that's something that we were really bitter about happening because there is no check or balance. The same thing happened, I want to say Cameo Voorhees was given $100,000 to develop the little brick gas station on Guthrie and Anger. So there's all kinds of money that's going out the door. And I just think, and I know Carl and I have had a conversation about this, but for some reason, folks are really willing to jump out on a ledge and get super creative about giving certain companies and people money, but then when folks that look like me and Carl show up to the table with our creativity, we can't seem to squeeze water from a stone. And so that's like the black and white of it, literally. He's got a really great project, the Witter.
It's school, and that's made possible because of a public-private partnership, largely led by the county and the Durham public school system and the city, and a private developer that was brought in from Atlanta to do. So you're talking about 79 affordable senior units, 8 classrooms that will accommodate 144 pre-K kids, and restoring a building that's got, a tremendous history and an import to the African American community.
Is that in Roxborough?
Roxborough. But that project was super duper challenging, and Commissioner Reckower is here, and it took some, almost 30 years before something really happened again. But then I'm an owner in the Trust Building downtown Durham next to a building, 21C Museum Hotel, which we also helped to bring about, and you don't have the same kind of challenge. So you got to say to the private sector that some of these more challenged communities, we're going to be with you to help make it successful and not so difficult. Because otherwise, private capital is going to go where there's the greatest return. Right now, these communities that we're talking about, you can't sell your house. Habitat can build as many houses if you know that you have warehoused all of the poor people in one area. Come on. I mean, what's the real value of that? And that's what we're doing. And I think the HUD and housing agencies are starting to come up with ideas around declustering a lot of the housing, which means that we need to be in communities where we have been redlined out.
I know this gentleman had a question, and then we're going to have to wrap up.
All right. It seems like the root of all the problem is economics. And he talked about how do you train people now to have a job that they can be self-sufficient. You can't get into housing if you don't have a job. So if you got to start at having a job, how does the city or Durham County, everybody together going to train help train people to be, qualified for the new jobs coming? Is anybody making a big effort to train the next generation?
I think there's some efforts being made. I mean, there are a lot of good community college programs that actually partner with sometimes new businesses. But I remember talking to former Governor Hunt a while ago when they closed down Pillowtex in Kannapolis. I don't know if you all know where that is. And thousands of people lost their jobs in one day. And then they've rebuilt it into this research campus. And I remember asking him, like, so, Governor, how does this new campus help, those 6,000, 7,000 people that just lost their jobs, not too long ago? And he was like, this isn't to help them. I mean, he said, this is to help their children. So it's almost like up to you to almost make sure, that next generation definitely works very hard to be aware of what they need to focus on for their futures as well. But he clearly says, like, you can't go backwards. Like, we can't retrain people who didn't graduate from high school or started in something in a community college program, and that's not the specialty anymore. He was like, this is pretty much for the future. And I interviewed him many years ago, and I think about that every day. Every time I visit another community in Vance County somewhere, I'm like, you see families struggling, and I'm like, you better focus on those kids, and demand that your community provides them with the training for the jobs of the future. It's just like mandatory. So I know I've been waved at. It's time to go. Did you have one more thing to say while you have?
Yeah, I'll just briefly say economic development in Durham, they recognize that there needs to be a refocus on sort of regional kind of commercial nodes that are in more residential areas, like down on Fayetteville, for example, a good example of this. And so they are recognizing that obviously there needs to be a way to kind of activate and empower those sort of small commercial districts that are dotted throughout the city and county, and are exploring better options with job training at Durham Tech. We are also trying to find a way for Durham Tech to partner with us, as they did years ago, to train folks to do some of the fancy rehab work that's happening across Durham, because a lot of it comes from outside of Durham. So that's another issue. That's right. Yeah.
Well, thank you all for coming this evening.